Hello and welcome to Sheila Lives Out Loud. My name is Sheila Moniga and I'm super thankful that you're on this channel. As always, please click subscribe and hit notifications so you keep up with episodes as we upload them every Monday. And in this episode, we continue with part 2 of a conversation with Dr. Tasneem Yamani on caring for the elderly. Fear is a huge factor that keeps not just children quiet in the face and the occurrence of consistent abuse, it also happens to elderly people too. Dr. Tasneem Yamani shares more.
Older persons are so scared because they're dependent.
Yes.
It's like a child. If child abuse is going on, nobody is going to know unless the child
cries, speaks, or there's evidence
and
of
they can't
it.
talk.
And they can't.
And then they won't talk out of the fear.
Out of
because
fear.
if I say something, I might get hurt further. So this older person knows I'm dependent on you to take care of me. If I complain about you and you're left with me, you might hurt me even more. I'd better keep quiet.
Which is exactly what was happening
In
to that
case,
woman.
she tried to reach out, but we are so unaware of these things as a reality. And if only we would be a little more aware, it would prevent it from happening to us and happening to the people we love.
That's true. And being aware sets the scene for being proactive.
Exactly.
It sets the scene for saying, I'm not going to sit here and watch this happening and just shake my head. Because I tell you what we did as a family, because my mom was there, I was there, my brother was there. We reported what was happening to the hotel manager. We had to let them know that something was happening to this elderly lady. She was being abused by someone who was supposed to be providing care for her. And we ensured that the manager also spoke to the family members. My mother made sure, she said, you guys, this woman, you're not taking care of her. Take care of her because she's going through stress. And that made me think, you know, when you grow up as a child, when we were younger and you grew up, if something wrong was happening in the neighborhood, maybe the housekeeper is beating a child, you would hear and someone would come and actively engage and say, huyu mtoto nitamchukua, and she will stay in my house during the day until Johnny, when the woman comes and I'll tell her your child, she's suffering. But with old people, we watch and we walk away. People don't want to get involved in the business.
And again, that's because we assume if an older person is shouting about, we assume it's just they're old.
Right.
We don't realize they're not just old, there's something wrong. We don't want to be aware of the medical signs that could easily prevent things from being worse. Like we say, you forget your stuff, I forget my things. I mean, I put my key somewhere and I probably won't remember where it is. So just because my mother does it mean she's demented? No, it happens to all of us. But my mother doing it should make me alert that, wait, let me try and see, is there more happening early so I can do something? Like, for example, dementia is one of the most degenerating conditions in older persons, and it affects more older persons than it does younger persons. And if I'm able to pick up the signs of it coming early, there are things I can do. I can't cure it, it doesn't have a cure. That's the sad part. But I can do things that will prolong the progression. So rather than I can stay in stage 1 rather than stage 4.
A bit longer, exactly.
Which means while I'm in stage 1, I may forget a few things here and there. I might get angry all the time about a few things here and there. Those are personality changes, behavior changes, mood changes, nutrition change. All those are part of dementia.
Right.
And those are early. So if I'm able to identify all that early enough and do the right thing, for example, having a social circle at an old person keeps dementia at bay.
Right.
So if I'm already prone to it, it will prolong that phase of me being productive and in my mind and enjoying my life.
So do not
create
uproot.
a social circle. But how many times do we say, I'm not taking my own mother out, it's too much of a task. But that's because the environment is not created. I mean,
it's not conducive.
Do we have
to
a school?
go.
We have different Montessori schools for children. From the high end to the low end to the middle end. But does anyone have a school that teaches geriatric people or older persons who have retired a new skill?
Or no.
That thinks about their financial space? Because an older person, more likely than not, wouldn't have the finances at hand that you would have for your child. Because you're working. They're not working. They've retired. Their financials are now a resource that is limited. And it more likely will be limited unless they have millions lying around somewhere, which is not for everybody.
Not so many of those.
The majority is not there. And for the ones that have the millions lying around, they have the facilities. We have old age homes in the country. I'm not saying we don't. But the ones that are existent are for the high end.
Right.
For the ones, and the majority of the population that's old is not the high end. It is the lower income and the middle income, who are barely surviving on a salary of maybe 100,000 a month.
Exactly.
And many homes of those are in the ranges of $1,500 a month.
Yeah.
Because most of these are geared for people who have worked outside the country and have come back to retire at home. So they have the pension coming in from the different governments or wherever they've come from.
And those are the really lucky ones. Because there is another tier. For instance, domestic workers, someone who was a driver for someone, when they retired, they don't have a pension to speak
They probably
of.
don't even have a home to go to.
There you go.
You know, we all say they'll go back to the rural home. Do they really have land? And even if they're there, do they have access to what requires? They'll sit in their house and grow old with no support. Yet if they were given that environment where there are 10 other old people, they'll meet, they'll talk, they'll share. It's like saying, can you socialize with a 2-year-old? No. But a 2-year-old with a 2-year-old, I mean, you could
They get along like a house on fire.
You can entertain a 2-year-old. You can entertain them. But for a certain, and that 2-year-old will get bored with you. But leave them with another 2-year-old. The day will pass and they won't even notice. Same thing with this person. They need people with their mentality to interact with. Are we creating clubs for them? No. Are we taking care of their psychological needs?
No.
Where they are able to come and say, my daughter is mistreating me, my son is beating me, my daughter-in-law is not feeding me, without the fear of repercussions.
As well as inclusion on a national level. And inclusion of elderly people is not saying, you know, more appointees post the age of X.
No.
It's saying, no, do we have people from that age group who are putting on the table the issues, the problems, the needs
that they've
of
had
the aging population?
Exactly. It's not being discussed. They're treated like they have nothing to contribute.
Yeah.
Yet, I mean, years of experience will teach me more than a book can teach me in a year.
Exactly.
You just need to tell me. And if I'm going wrong as a younger person, you've done it, lived it. You've already made that mistake. If I can learn from it, have I saved money? Have I saved time? Have I saved a mistake?
Right.
And that just means I need to give that older person the opportunity to be able to share. And why then should we have a retirement age?
Yeah. You are as
Who
productive.
is there to determine that at 60 I'm not working?
Should stop working
Me
now.
at 60, I could probably be really ill and I can't work. Or maybe at 50 I can't work.
I mean,
but you're
there are
retiring
people,
me at 60.
Here's the thing. There are people who are 21. Something happens to them crossing a road and they're no longer productive. Something changes.
But yet somebody productive at 70 is being told, no, go sit
Yeah,
at home
go sit at home because you're 70.
It's a
that's
stereotype.
not right. Yeah.
And you see, yes, I know we do slow down and there's certain time. So there should be that space that when you're in this age group, these are the kind of jobs that should be availed to you to do.
Right.
You can teach, you can learn, you can share experience, you can do so much with it.
Right.
But I come down to the bottom where where my field comes in. Without health, you have nothing.
Yeah.
To maintain health, nutrition, exercise, taking care of comorbids. Like if you're diabetic when you're young, take care of yourself, do the right thing. So that when you're 80, you're not giving into the complications of diabetes.
And they can be intense.
And if you're 70, if somebody is doing routine visits for you, checking up on you, before you're in kidney failure, you're picking things up so you can prevent them from being on dialysis 3 times a week. I mean, if it's going to happen, it still may happen, but if you can prevent and cure, not cure, but create health. You're creating health rather than curing disease. Can you imagine how much healthier
you've got a better chance?
And again, geriatrics is not about just me as a one person. It's a team. I need the cardiologist. I need the psychologist. I need the psychiatrist. I may need the dermatologist.
Right.
I may need the ophthalmologist. Now that I mentioned ophthalmology, cataracts is a disease of older person. If I have a cataract and nobody takes care of it, but I assume if I say I can't see, these people will take me and get me glasses. It won't help.
Yeah.
But if even your GP could come and tell you it could be a cataract, get it sorted out. It could avoid that person from having a fall that will lead to a break, which will disable them. A walking, talking person becomes, and I say this because I lived this journey.
Right.
I'm hoping my family won't mind me sharing this, but a family member went through this. They fell at 70, broke their limb, were hospitalized. She probably spent more than 6 to 8 months in hospital and finally passed away. And that's what got me to do what I'm doing. That was one of the biggest encouraging factors, because I saw, because I'm a doctor in the family, I couldn't say much because I'm family. But from looking at it, I mean, I give myself
looking
credit.
back now.
No, even then, I give myself that credit of being able to take myself out of a box and looking at it neutrally. But when family is involved, you wouldn't
it's very
give
hard to
it's
be
hard
as
to give that
objective,
opinion.
yes.
So you base yourself on other professionals' opinions. And I was like, if only we had somebody who could come home and take care of her, she might have been there today. She may be here today. She may not have suffered so much. Because funny enough, she came home at the evening and she died the next morning. She just wanted to come. She was fed up.
She was just done
of being
there.
in hospital.
Yeah.
She was crying to be taken home, and she was just not being released because they're like, no, we need. And I was like, if only somebody could do that for her at home, she would be happier. Should have spent a little more days with her grandchildren, because you can't take kids into the hospital.
No, you can't. Yeah.
That would have given her a reason to fight to live.
Yeah.
Because really, let's face it, at 70 or 80, you've lived your life, and you live and ask yourself, why am I fighting to stay alive anymore? What do I have to gain? At 40, when you have 2 kids, like
You have
even when you have
everything to
you
live
will
for.
fight because you have
Yes.
kids, you have a family, you have something to live for. At 80, if they have no reason to live, why are they fighting? Yet they could be in good health, but they give up because what's the point of living where I have nothing to do
And where
with
the
my life?
quality of life is so difficult.
Where somebody is telling me, I can't do this, don't do
Yeah,
this,
don't do this, don't
why,
do this,
Why
don't do
should
this.
anyone dictate how they should live? Give them dignity.
Yeah.
Give them health, give them a chance at health. Give them a chance to take care of themselves. I mean, which brings me to frailty. Frailty is part of what we call there's something called geriatric syndrome. It's conditions that are otherwise excluded elsewhere, including things like bedwetting, frailty, dementia, depression, all come under a geriatric syndrome. And if you could pick those up early, you can put things into place for them to live as normal, as age appropriate.
Right.
Frailty can easily be prevented by strength training exercises. But how many old people do you know that do that? Why? They can't go to the gym, understandably, because there's so many things that can hurt them there.
Yeah.
But if we had systems where this is a gym, why do we have gyms for ladies?
Yeah.
I'm Muslim.
Right, there are
There are
gyms for
where
ladies,
there's
gyms for men. Yeah.
And that's because you're catering for that population. So why is no one catering for this? Have equipment that is safe for older persons, weights that are lighter, water, activity.
Right. And
brings me back
trainers
to
who are
hydro-
conversant
with how much you should do for an older person, where
Yeah.
it won't hurt them but help them.
Yeah.
Because strength training keeps their muscle tone. Muscle tone being there means they can walk. If they can walk, they can do a lot. You know, being bedridden
Is
or being
not-
dependent on somebody to walk is the worst thing in life, because it makes you just feel like you're a burden.
And especially when
For
it happens to
I
someone
need to
who's
go
been
to the
so
toilet, I have to
active.
call somebody.
Yeah.
For something that you don't need anyone, you have to call because you can't take yourself. And that's how they fall, because they
You're
will
still trying to
refuses
reclaim
that
your
I can
independence,
walk.
that
And
you
then,
can still
then
do
we
it.
shout at them. Then
Yeah.
why didn't you call for help? And now
Yeah.
you've gone and fallen and
Yeah.
broken a limb,
Now
and you're
see-
yelling at
and you're
them.
yelling at them. So
you may
it's-
be yelling from a good place because you care.
Yeah, but
that
they're
yelling is
not
making
picking
them
it up
feel,
that
I mean,
way.
as an adult, do you want to be yelled at by anyone?
Nobody wants to be yelled
We
at.
say don't yell at children even.
So don't yell at
So
the
how are you
elderly
yelling
too.
at an old person who's lived their life, seen it all, and expect them to feel that they're dignified, they're respected?
Yeah.
And no matter how good the intention, if you're not aware of what you're doing wrong, you can't correct it.
Yeah.
And that's why, I want to say thank you to you, Sheila, for having this conversation.
I'm thankful that you
Because
made the time.
I honestly have tried to reach out to so many people to have this conversation with me. But because it's not fashion,
and it's not
what
popular
designer
or
brand to wear,
ratchet or
it's not
you
about
know,
which hotel
sensational.
to visit.
Yeah,
Exactly. Nobody wants to have this conversation because it's giving me nothing back. It's giving you nothing back, but it's giving back to a lot more.
Yeah.
But it's not. The return is not now.
It's not now. It's about.
The return is for the person who's caring for an older person. The
Yeah.
return is for me when I'm 80, because if you and I do this right, by 80,
We'll
we'll be able to be
okay.
dancing.
Exactly.
I mean, how many Facebook videos do you see of old people dancing?
Yeah,
But how many
or-
people are actually
or
doing
it-
that today?
Yeah.
Because everyone assumes they can't. But if they're taking care of their strength training, if they're taking care of the right nutrition, if they're
Yeah.
taking care of mental health.
Right, you were even going to talk about water
Mental
before I
health.
interrupted you. Yeah.
Yeah, water therapy. I mean, hydrotherapy, and I don't mean going to the physiotherapy part, just entering a pool, even if you don't know how to swim.
Yeah. Just
Entering
being
a pool.
in the water.
That is least impact on your joints, less taxing, and the best exercise.
Yeah.
And I'll give you this. Who says that when you're 60 you can't learn how to swim?
You can.
My mom
Yeah.
doesn't know how to. She's always been scared of water because she gets cramps.
Yeah.
I'd gone down to Mombasa 2 years ago and I told her, let's get into the water. She was so excited to come. Then she was holding on to me like my little baby who is holding. And it was a joy to watch because she was so eager to learn. And she learned how to
Yeah.
move. And she was so happy that she could do that little. And the joy it gave her was like, I can take her to a pool. And she even asked me, is there someone that can teach me how to swim? And how many people are willing to give older persons that class?
Right.
There's probably, I know one, that's like, bring them, we'll do something for them. But getting trainers is hard because no one wants, they're like, how many old people will we see?
How many will come for the class?
How many we have to understand where they're coming from. It has to be sustainable for you as a person because you have a life to live.
True, true.
I'll give you an example. I had approached a hospital to talk about spreading out this geriatric space where, okay, I don't want to work for you, I can work with you.
Yeah.
But call me for patients that need home care. I'll come and I'll go home. And I was asked this question by a doctor, which I found very sad. They're like, why are you only doing the geriatric space? Why don't you just make it for everyone? I'm like, you know, everyone else can bring themselves to a hospital. Yeah. You don't know the journey this person takes and what the effects of them coming to a hospital is. I don't want them admitted. And if they're out of the hospital, chances are they won't come back for their post-admission review because it's just hard. Imagine if you had a parent who's had a stroke. Transporting them is not just sitting in the car and take them. It's very, and you may take them for the first one. And you won't understand why it's important to have regular reviews because you're trying to prevent it from getting worse. Like I say, you can't make it better, but you can maintain it at that
Keep
point.
it on that stage
maintain
as
what
long as you
can
possibly
for as long
can.
as you can, rather than going downwards. Because downwards gets only
Because once
harder.
you start going downhill, it's downhill
and having
fast.
a stroke is already hard.
Yes.
They may never walk again. Let's keep it expectations real. I mean, the outcome of my patients is poor. I probably have more death certificates in my CV than I have life. But you see, for me, it's not about how many
it's the
people
quality
died. It's
of
how much
that
quality
stretch
whether it was 1
before
month,
it ended.
2 months, or 3 months. Did I give them quality?
Yeah.
Did I maintain quality? And that's the idea, maintaining quality of life.
Our parents have sacrificed, they've done the very best they can for all of us. It's only fair that we do the same for them.
I mean, but everyone assumes the old person has nothing to give. I mean, sit with an old person for one day and see how your time will pass with the stories they have to tell. But if they're kept in a good mindset, they're able to share that. And you know how much you can learn from that?
Yeah, it's so
it's
much.
The amount of knowledge they can give you. I mean, yes, we're in a technological age, we're in an advancing age, everything is advancing. And we seem to think we know it all. Because we are so with it, you know what I mean?
Yeah.
And we feel like, oh, they don't know how to use all these small things. But you know what they can share with you? I mean, this is personal again. My dad's a doctor.
Yeah.
And there's certain things he's done all his life that have helped me help my patients. They're old school. They're probably not even practiced by doctors. We're not even taught that in
read them
no,
online.
we're not even taught that in med school. But I have done it practically. He has, 50 years of experience. And I learned that
There's
from him.
no way you're going to knock that.
Why am I fighting it that, it's old-fashioned, why are we doing it?
Right.
It's worked and it is working. So why am I disregarding it? Why am I not willing to take that? So I can only tell you about the medical field because and I'm sure that can exist in all
so many different
fields.
Exactly.
That what they did, yes, there may be better ways of doing it
today.
today.
But then there's some things.
What they did worked. It's working. Why not? I mean, like I was saying, giving them the opportunity. If you created an area, for example, I decide I'm having a geriatric school where older persons can come and learn art. Just for example, somebody probably all their life wanted to learn art, but they had kids, they had life, they had work, they never got around to it because they got busy in life, living life for the moment. Now when you're 70, you're like, I can learn art.
Yeah.
But where do I go learn art? I'm not, as a 70-year-old, you're not going to go to a class where they're 18-year-olds. You'll feel conscious. You wouldn't want to learn. And even the teacher wouldn't be able to teach you. You know, they won't teach you. So what if I open a school for people to learn art at that age? What is that one old person creating? Employment. Somebody who wants to teach is getting a chance to teach. So you're creating a job, you're creating an income for somebody else, you're creating that one old person or that group of old people learning to
that happens because
and
of
that
them.
Has a ripple effect on our economy. It has a ripple effect on, so how have they then become a burden? Aren't they an addition to your society? They're still a customer. Why are old people not allowed to be a customer? You're creating a business for them. And that's the supportive environment. I mean, it's something that exists in another part of the world. The Western world is getting there, it's gotten there. We're still lagging behind because we are focused on wanting to charge exorbitant monies to people. But most of the population can't afford it.
Most of people can't afford it.
And if something is not affordable, then it's not accessible and it has no point.
And it stops being a priority.
I may serve the 10 people. I may serve the 10 people because it's keeping my business going because it's paying so much.
Yeah.
But have you really helped somebody in that? Because that person who's old and can afford that can afford everything anyway. They can afford the best doctors, they can fly out when they need to. What about the one who can't?
But what exactly?
Where do they go?
And they're
Are they
still
supposed to just
as important.
And they're still as important. Every
Yeah.
life is important.
Right, right.
Every person is important. So why then is there a discrimination on my financial status?
Yeah.
Which brings me to advanced planning. How many young people
Are planning
for
for
retirement?
that stage? Not too many.
All of us are so good on living now, providing for now, getting this done, having my house now. You may have your own house, but if you're no longer working and you haven't sorted yourself financially, how are you going to eat? Then you're going to go through the whole becoming a bird feeling. You're not becoming a bird.
You're not,
I mean,
but
okay,
that
and the
feeling,
generations
it's
are
a
changing. Let's face it, the world
Yeah.
is becoming a very selfish space.
Yeah.
I mean, I'm saying it out of
No, but it's
seeing.
true. Everybody's looking out for number one, and
So
number
my
one
parent
is
is not my
themselves.
priority.
Yes.
Me.
It's
Then
me,
my
myself,
wife or
and
my
I.
husband, then
Yeah.
my children,
Yeah.
then my friends, then maybe my parents. You know, somehow that is the world we're in, where parents are the least important suddenly, and yet they should be the most, because cultures have changed.
Right.
And in that change of culture, if I haven't prepared for that age, then I am dependent
You're going
on
to
you.
fall through the cracks.
So when I
yeah.
am sick, I'm not going to tell you, because I'm thinking,
I don't wanna be
we
a
never-
burden.
Exactly.
Yeah.
My son is struggling so hard, or my daughter is struggling so hard to provide for a family. Now, if I go to the hospital, they have to pay my bills. And I mean, Sheila, healthcare
yeah.
in Kenya is
It's expensive. Yeah.
Whose insurance companies are they insuring old people? We have no
In
insurance.
fact, the premiums
for old.
on elderly
There are none. I mean, they have 70 as a cap. And then even when there is a premium or a service available,
Yeah.
it has what we call sub-limits. So if you have a chronic condition and you're admitted, it will not cover for the full limit. Really,
So
when
you're
I'm old,
back to-
chances are I have hypertension and that's what's going to take. Really, if I'm healthy, I'm not going to go to the hospital. And I'm hoping that people are listening now.
Yeah.
Because at one point I felt like I'm alone.
You're not.
But I realized, you know what, if I don't start, nobody will. And it takes one person to spark it. And if you can be that spark, it will ignite many more. And hopefully somebody will listen and somebody will want to do something. Just like I said, I mean, maybe somebody out there has a business chance and they were thinking, what can I do? Here, I'm giving you an
Here's an
opportunity. Create a
opportunity,
place,
yeah.
something for an older person.
Right.
Be it an exercise room, be it a school to learn a new talent.
Yeah.
And do your research. Find out what older persons didn't get a chance to do when they're young.
And there could be
Maybe
your
old
business
people like
gold mine.
writing.
You never know. Exactly.
They love writing. They have so much to write about. Give them that chance.
And they used to write. I mean, you know, they grew up during the post office days.
Exactly. They didn't have social media to copy paste
Yeah.
people's
No.
status.
They
and
literally wrote,
They
"My
created it out of
dearest."
here. They didn't need to
Exactly.
Google. They didn't have Google. They had to think it all out.
Yeah.
Right now we can Google things and pick up words and put it together. You know,
So,
our
yeah.
age is so easy compared to them.
Yes,
and
it
they have so
is.
much to share. And if you could only go back to that life, even the future generation. I mean, let's talk about the world. We're destroying the world. We as humans are destroying our world with everything we do.
So we just need to just get back to the
to
basics.
And,
become
who's better to teach you the
responsible.
basics than
It's
the older person
elderly
who's lived
people.
there?
Yeah.
They've
Someone
been
who's
there
been
in the
there.
like we keep hearing. I mean, if you sit with your parents and say, they're like, in our days, life was so much better. In our days, life was so much. They keep saying that
Yeah,
to you.
yeah.
Because they see what we are doing as a younger.
And
they can only
see
say
that it
because
could be
how-
better as well.
I mean, they see, yes, they mention, yes, technology, it's good. But quality of life in that day, how many kids do you see playing outside?
Not
Most
very
of them
many.
are on
They're
their gadgets.
indoors with,
And is that
yeah.
really healthy? All studies show that's not the healthiest thing you're doing for a child.
Yeah.
But it is what we are all doing because it is what we do. It is the life we're living now.
So let's all get ready because it's on the way. Dr. Tasneem, thank you so much. You know, we could talk about this until tomorrow because
Yes,
you're
it is
so
why.
passionate about it and I feel very strongly about it too. But this conversation has only just begun. Let's begin to take responsibility, and I know you are so, there's something that you're working on, hopefully towards growing this sensitization and growing the awareness of prioritizing care for the elderly. We can begin to get this conversation going to the right places. We can begin to get the right policymakers talking and focusing on a generation that has been overlooked.
And that is prepared for what's coming.
Right.
Like I said, we are aging, and in the next 30 years, we will be that population.
Yeah.
And if we don't create it for ourselves today, we will be the ones suffering. It will be a crisis.
Right.
It will become like HIV. When HIV was discovered, nobody was doing anything. Then suddenly everybody has HIV. And now everyone's putting in funding. But if we had prepared for it,
Right.
we may never have been in a crisis.
It wouldn't have been as
So let's
horrible.
prepare before we are in a crisis. And it doesn't take a lot.
No.
They just need to be heard, to be given the care. And I think it's very simple.
So let's keep this conversation going. Thank you so much for watching this episode. Please drop us a comment and remember to click subscribe and hit notifications so you don't miss out on next week's upload. Until then, we're signing out from Sai Suites Apartment Hotel, luxury redefined. We'll catch up next week. Live out loud in all that you do.